Hi there, I'm Clara, and I'm a researcher for the imAPP study. You're probably watching this because your therapist thinks that you might be eligible to participate in this study. Let me tell you a bit more about it. Have you ever wondered how we know if psychotherapy works? And what makes some treatments work differently than others? Or how we train therapists to provide effective treatments? And how we know when they're providing these treatments effectively? Right now, the only way to really do that is to listen to all your therapy sessions. As you can imagine, this is not something that everyone feels comfortable with, and it also takes a lot of time. So instead, we're trying to find a more comfortable and efficient way to find out what's happening and what's working in therapy. We want this process to be easy for therapists and clients to use while maintaining confidentiality, and we want to include you. Your thoughts and opinions on what's going on in therapy will help us learn how to help people feel better. We did some preliminary research and found that there are a couple different ways that might work, so we're doing a study that compares these different methods. One way is to ask therapists to share their clinical notes using a checklist that shows some of the things they did with you in session, but without your identifying information. A second way is to look at the CBT worksheets you and your therapist complete in and out of session. We would do that by collecting paper copies or by asking you and your therapist to do them on a mobile app. We are planning on comparing these two methods with the information we get from recording the sessions to see if they map onto each other, and if the information gathered in the two methods relates to changes that you experience as you go through therapy. We are inviting people who are engaging in or using strategies from cognitive behavioral therapies for depression, anxiety disorders, and PTSD. We will ask your therapist to share copies of your worksheets and clinical notes without your identifying information, symptom measures, and audio recordings from each session. Half of you will be randomly chosen to do worksheets using an app, and the other half will do them on paper. If you are ever discussing especially sensitive information, you can stop recording or ask your therapist not to give us that recording. We keep the information as anonymous as possible and on very secure servers, and restrict access to that information to only trained study team members who take your confidentiality very seriously. At the end of treatment, we'll ask you to participate in a short interview on the phone to get all your feedback, which will help us figure out what the best strategies are to find out what's happening in sessions, so we can train and support therapists who provide CBT. To thank you for your time and your valuable help, we will send you $25 after you complete your 4th recorded therapy session and $25 after we get your opinions in the interview at the end of protocol. We would be happy to talk to you if you have any questions. If you decide this is something you want to try out, we will explain the study in more detail before you decide whether to participate. Your therapist has a form that you can sign and then send to us, the study team, giving us permission to call you about the study. Know that even if you do decide to participate, you can stop participating at any time or ask your therapist not to send in any information that you'd rather not share with the study team. So, if you're interested in contributing to this study, please fill out that sheet your therapist has, and we'll call you whenever is most convenient for you. Thanks for watching, and we hope to talk to you soon.